it's CJ. Welcome to week 26 of your pregnancy. Today we're going to talk about what's happening with your tiny human, some of the more common symptoms that you might be having, what you can do to help alleviate those symptoms, and what symptoms are not okay. And if you stick around, I will give you 10 things that you can do that might help alleviate some of your lower back pain. At this point, your little one is now about the same length as either a green onion or a spaghetti squash. It depends on what app you're looking at. He or she is now measuring about 13.8 inches, that's 35.1 centimeters, from the top of their head to the bottom of their feet, and weighs somewhere between 1 3/4 and 2 1/4 pounds. That's 780 to 1,038 grams. At 26 weeks, your baby now has both eyelashes and eyebrows. Not only can they hear your voice, but they're reacting to it as well. This week, if you have a little boy, his testicles are starting to descend into the scrotum. And if you were to deliver this week, and I hope you don't, but sometimes it happens, you have access to excellent neonatal care. Your baby now has an 87% chance of survival. Here are some of the more common symptoms that you can expect now that you're 26 weeks pregnant. Number 1, your fundal height, the top of your uterus, is now measuring between 24 and 28 centimeters from the top of your pubic bone. Number 2, your belly button. It's now either flat or starting to pop out a little bit. Number 3, as your pregnancy progresses, you might be starting to feel more stress or anxiety. I recommend using relaxation techniques, breathing exercises, going for a walk, doing yoga. If those don't work, please talk to your doctor about your anxiety symptoms. Number 4, frequent Braxton Hicks or warm-up contractions. Number 5, because of weight gain and hormonal changes, lower back discomfort or pelvic pain. And number 6, round ligament pain. Every time you make a sudden movement, you get a pulling sensation down deep in your pelvis and it can take your breath away. I recommend doing gentle stretching exercises during the day, staying well hydrated, and if you know you're going to make a sudden movement, splint or hold on to your tummy. So, what symptoms are not okay? If you are having 5 or more cramps in 1 hour, I recommend empty your bladder, get off your feet, and drink 32 ounces or a liter of water. If the contractions do not go away, you need to call your provider. If you are bleeding heavy enough to saturate a pad, if you have water running down your leg and you know it's not urine, if your baby is not moving like he or she normally does, if you have a headache that doesn't go away, visual changes, or pain in your upper abdomen behind your right breast, please call your provider. And finally, here are 10 simple steps that you can take that might help alleviate some of your back pain. Number 1, wear flat-soled, comfortable shoes. Number 2, sleep with a thick pillow between your knees at night. Number 3, try using a pregnancy support belt. Number 4, massage. Number 5, a nice warm shower or a bath with Epsom salts before you go to bed. Number 6, a heating pad on low. Number 7, stretching exercises during the day, such as prenatal yoga. Number 8, avoid any heavy lifting. Number 9, consider either chiropractic care or physical therapy. Number 10, if your back pain does not go away in spite of these conservative measures, if you're having back pain accompanied by vaginal bleeding or an elevated temperature, please contact your OB provider right away. I do hope that this information has been helpful and that if you have any questions, you'll let me know in the comment section below. And while you're in that comment section, I would really appreciate it if you'd hit the like button or even feel free to share this video. Hello, it's CJ. Thank you so much for watching the entire video. I truly do hope that the information has been helpful. When I make these videos, it is not meant to replace a visit with your healthcare provider. Rather, my hope is after watching my video, you know what questions to ask your provider at your next visit to best meet your own healthcare needs. In the meantime, if there's any questions that I can answer, I hope you'll reach out to me. And finally, if you have not already subscribed to my channel, I'd really appreciate it if you did that. That's all I have for today. This is CJ, and I am at your cervix.